Good afternoon everyone, and welcome to another update on the coronavirus pandemic that we have across the world. I'm Dr. Skalkberger from Dr. Luke on Call, and today we're going to talk a little bit of statistics. Some of you might not be familiar with the websites that are tracking the numbers across the world, but I really want to talk to you about the statistics and why they show that a lockdown and an extended lockdown that we now have is absolutely essential. I'm going to show you that countries that did not do a lockdown or started their lockdown very late had very bad results with the numbers of cases that was absolutely escalating across the country and is now stretching their healthcare systems way beyond what it's supposed to handle. So let's look at the first site that I want to speak to you about. It's called Worldometer. I think a lot of you maybe know this site. Currently, where we stand at the moment, you can see we have over 1.6 million documented cases. We also see that over 97,000 deaths has occurred. If we scroll down, we can look at the current figures. America leading, the countries with 475,000, a little bit more than that. They've had 6,671 new cases today. If we look at yesterday, you can see that they had 33,000 new cases yesterday with 1,900 deaths. A couple of countries that are really struggling at the moment: France, 1,341 deaths, and also if you look at the UK, 881 deaths yesterday. So this is a really interesting site to look at. You can also click on the specific countries and they will give you detail on the country. Let's go to the UK. The UK will give you detail of specifically what's happening there, their own numbers, also the graphs that they have, the number of new cases in the UK and the active cases, the total deaths, and the number per day of total deaths. Very accurate, very good information. Another site that's really informative is the COVID-19 projection site. On this site, what they do with a lot of computer data, they project what would be the resource shortage, either for beds or for ICU needed. So they say that America is one day until peak resource, which would be 11th of April. Now look at this, all beds needed, around about 94,000, bed shortage 15,000, ICU beds needed 19,000, ICU bed shortage 9,000 ICU beds. You can see that they really are going to struggle to deal with what's happening, and that's why if we go a little bit lower and look at deaths per day, the red line, the solid line, is the deaths, and the dots are the predicted numbers. So if we go up there, America has really spiked. They've gone all the way up to over just about 2,000 deaths a day. Projected that they will spike around 2,200 and then slowly come down over the next sort of month or so towards the end of May. You can look at a lot of different countries that have got this number. If we look at the United Kingdom, interesting, they have got measurements in place which the United States doesn't have. They've had a lockdown order on the 23rd of March. They've had educational facilities closed. They've had non-essential services also closed. That has helped them in a way, but you would see on the graphs that we're going to show just now, they did this quite late, and the numbers of deaths have already been quite high. The UK is a slightly earlier situation than the United States. They currently have around 600 to 800 to 700 deaths per day. Predicted that they will spike up to over 2,000 deaths a day around the 18th of April. And simply because if you look at this purple line, that purple line is their capacity, their hospital bed capacity. But because of their curve that's not flattened, they will exceed their capacity by far. You can see there, beds needed 102,000, shortage 85,000, ICU shortage 23,000. So it goes way above their capacity. And if you go look on the site at some of the countries that have actually not got those sort of numbers. If you look at Portugal, Portugal already in February stopped non-essential services. Before the UK, they closed down facilities and they had lockdown orders on the 19th of March. So they've made a big difference. Now look at Portugal's capacity. There's the purple line. So their hospital capacity is way up there, but they've got incredibly low numbers at the moment, and deaths per day in Portugal spiked around 37 deaths a day over there. So they're looking a lot better, and because they had a much earlier lockdown and they've kept it closed. Remember now, this is almost a month, let's say 3 weeks already, and that was the result. Okay, next I want to take you to some graphs on Twitter. Credit must go to John Byrne Murdoch for setting up these graphs. You can you can see his Twitter handle there, and he's got these amazing graphs that we compare the different countries on the same scale. This is the daily death toll, and you can see it's a logarithmic chart. It's not a chart that it goes up in the same scale, because you won't be able to plot everyone on the same one, and these are the number of days. Now a country gets plotted after they've had 3 daily deaths or more. If we look at, let's say we look at China. China did a lockdown early on, and they went with a fairly flat curve. If we look at the green star there, that is Germany. Germany did a lockdown around day, when they had, Germany did a lockdown when they had about 13 deaths per day, and they ended up with around about 190 deaths a day. If we look at that little blue one there, that was Spain. Spain did their lockdown only when they had about 18 deaths a day. They ended up with 700 deaths a day. If you look at Italy, Italy only did their lockdown when they had around 75, 80 deaths per day. And we all know what happened in Italy. The UK, if we look at the UK did their lockdown at around 40 deaths per day, and they are still rising, as we discussed. The United States don't have a full lockdown. They've got social distancing and staying at home, and you can see where the United States are going. We just saw that they around about 2,000 deaths a day. South Korea have got very strong and stringent measures for wearing masks, not infecting people, social distancing. All these other countries are doing something that's giving them flatter curves. So all of them have got earlier lockdowns. If we zoom in on the countries initially, John produced this graph today, which is really interesting. It compares all the countries individually, the smaller ones that we don't talk about too much, compared to the bigger ones. And if we start there, you'll see these are all the curves. Some of them are flatter than others. If you look at Belgium, it's a little bit steep. There's the China curve that we discussed coming down. As we move down, a lot of them are still in the early phases of the disease. You can see some of them, like Germany over there. Then as we come down, this is now why the lockdown in South Africa was important. They were very sharp curves up there. That's Spain, that's the UK. Look at South Africa. We had a very bad start, on the same line as maybe Spain or the UK or the US. Then we had lockdown early, and it just turned around completely, all the way down there. This is where we are at the moment. If we did not have an extension of the lockdown, we would have gone that route. The fact that we are now having a further 2-week extension, which gives us 3 weeks from now, we really trying to get this curve as flat as possible so that we stay under the threshold of what our health services can really handle. So we really don't want to go into difficult situations like we have in Turkey, and especially like you have in the USA. I hope this has given you insight on how important it is to stick to this lockdown, and I really want to commend our leadership, President Ramaphosa, for making a very brave decision to extend the lockdown. I know it's really uncomfortable for a lot of people. Some are very fortunate. They've got homes to stay in, they've got food, they've got water, they've got education, they've got internet access. There are a lot of people in our country that don't have those facilities available at all. We really want everybody to focus on these next 3 weeks ahead of us and do the right thing. Have a structured and a planned day. And then also reach out to others. You know, there are amazing groups of people that reach out to others. I'm going to show you a short video clip of a local group of young people that are just doing amazing things to support the community. Have a look.
Guys, Enrique here from Worldometer.
Hi, I'm Wynand from Worldometer.
Greetings guys. So we just managed to do 220 packs last week and we're aiming for 300 packs this week. Quite a big total, going up to, I think that's 60,000 Rand this week. So it's gonna be lucky, but as you guys can see, we're on our way to Santa Crown. Look at those beautiful bags over there, looking good, looking very good.
Thank you very much for the people who helped us to pack it. People that went to go buy it, and yeah, we're really grateful for you. So if you want to get involved, please let us know. There's many ways that you can get involved. Donating is the most important, so we can keep on doing this in a safe and in a good manner. So yeah, please invest in us.
Yeah. Whew. Looking forward to changing the world with you.
Wonderful to see that. You know, it's absolutely encouraging to see how the country can get together. And I think the main thing here is that the unity that we as a community will have after this is going to be something that's going to really take us to higher levels, more than we've ever had before. Stay safe, stay healthy, and stay home.